A traveler was beaten, robbed, stripped, and left half dead by the road. A cleric and then a second traveler passed by, both avoiding the man. Finally, a Samaritan happened by. The Samaritan was so moved with compassion, he stopped and helped, binding up the injured man's wounds and pouring on oil and wine. He sat him on his own animal, took him to an inn to care for him. On the next day, when departing, he gave the innkeeper money and said, "Take care of him. Whatever you spend beyond that, I will repay when I return."
Homelessness is a situation, it's a circumstance. If you think of people who are proud and trying to maintain their dignity, if you think of people who are trying hard to get out of this situation, who feel not comfortable in it, that's who the homeless people are.
People used to talk about people all the time, about the homeless people. And I said, well, you never know what end up making a person homeless.
A person loses his job, breaks up whatever relationships he has with people who've helped him out because he can't give back, he doesn't have the resources, then becomes homeless, gets into the wrong setting, substance abuse sets in, medical problems set in, and it's like it can't seem to recover from that.
My childhood could be characterized as living in a concentration camp ruled by an evil, sadistic ruler. My dad beat the crap out of my mother and all of us kids, and I handled it on my own for a very long time. Made some poor business decisions instead of trusting God, which led me to jail. And then when I got out of jail, no one really wanted to take me because I was bipolar. I was on a lot of antidepressants.
The group we serve here are the highest risk people because they don't have the supports.
Our patients have physical illness, dental disease, a mental health issue at one level or another, and then there are those who are addicted.
These are real people with real issues, and they don't choose to be homeless.
I wouldn't know which way to go if the clinic didn't exist. So the clinic have to exist for people. And I encourage a lot of people to come to the clinic.
If the clinic wasn't here, I'd probably be in the grave, cemetery or whatever, because I was not doing good whenever I first come.
When I found out the services they had and got experience working with the people, I was really excited because it showed me that they really, really cared. If I wouldn't have had the clinic, I wouldn't have had that pull and that drive. I wouldn't have had that love.
If the clinic was not here, I honestly don't know if I'd be around today.
The dollars that are given to this clinic go for operations.
We are very resourceful. We use every possible way to make it good care, but fiscally responsible care. Our goal, of course, is to serve more people. So if we save, we can use those dollars for more people. In the end, it's an extremely successful way to provide health care. We save lots of money.
You know, for the homeless clinic, just in that project alone, the people, it's here in town, it's the people that we're trying to take care of. It's our community these people are touching people. I feel like it's making a difference. If I can help somebody and I can make a difference, I'm gonna do it.
I give generally because of my Christian faith, and specifically I give because I understand all of us to be part of a single human family.
There's a lot of different causes, and it wasn't easy. We have multiple interests. And I think somebody once said, the more you have, the more responsibility you bear. And I don't see it as a responsibility, but I think, you know, if we can look across the board, how much does one need, you know? And so I think it was an easy decision for us.
if I ever hit anything big or get any big money, they're going to get some of it because they have really been real good to me.
If I was to become a millionaire, you know, I mean, I would definitely donate tons of money to the clinic because they have done so much to me. I mean, they've done so much. I mean, they've done so much for me. I really can't explain it all.
I live in my own apartment now. I go freely. I love it. They have really, between Homeful and the clinic, they have really helped me.
There's only one Samaritan homeless clinic.
And I encourage everybody to just come and see.